Okay.
Good morning, ladies, and welcome to our fourth hypertension workshop. Today is Tuesday, September 1st, and Paula Rains is here to talk about hypertension, emergencies, and urgencies. We'll have one final workshop next Tuesday, the 8th, the same time, and we'll be talking about lifestyle modifications. Wanted to remind you that at the conclusion of the program, we would love for you to complete the program evaluation, and you can do that online. It's back in front of a piece of paper, as well as our pre-diabetes risk test that gives us some additional information and is required as a part of our grant. So in doing so, we can award you $5 gift cards for each time that information is returned. So we'll hope you'll take us up on that. Also wanted to remind you that we do have some self-monitoring equipment available to any of you interested in having that monitoring device at home if you have not been able to find insurance cover to help you with that purchase. Thank you for joining us today. Once again, this is an educational session, so not a telehealth service where clinical information, personal information is exchanged. It's intended to be educational information for everyone. So we will do the presentation, record it, and at the conclusion of the presentation, we'll do a demonstration of the self-monitoring equipment, and then we'll turn off the recording and open cameras for a question and answer session. With that, I'm going to turn it over to Paula.
Thank you. Hello, as Jenny said, my name is Paula Rains. I am a licensed practical nurse, and I am here to talk to you about hypertension emergencies and urgencies. Before we get started, I will introduce myself and tell you a little bit about myself first. I went to Slippery Rock University in a small town called Slippery Rock, Pennsylvania, where I received my bachelor's degree in exercise science and psychology. I graduated in 2001 and came to Connecticut and got my first job. Okay?
We're admitting another participant.
Sorry. Okay. And I'm sorry. I got my first job at Aetna, where I worked in their fitness department as an exercise physiologist. I did that for 4 years before being laid off. And once I was laid off, I decided to go back to school to become a nurse. So I enrolled in a program at New England Tech, which is in New Britain, Connecticut, now known as Lincoln Tech. And I did a 1.5-year program at that school and took my boards and became a practical nurse. After that, I started working for a small family practice. And I didn't last very long there. I quickly found out that, a brand new nurse should not be running an entire office. So I went to another facility to get some more practical nursing skills. And I worked for Salmon Brook Center in Glastonbury. I was there for 8 years, I believe, before I left in 2014 to come to my current job, which is a Central Connecticut cardiologist. I have worked there for the last 6 years, and for the last 3 years, I have been the head nurse in their Enfield office. So that is a little bit about me, and we will start going into what blood pressure is. I was here, 2-3 weeks ago, and I did a presentation on monitoring your blood pressure. So if those of you who might have seen that presentation online, you will see that we are going to cover some of the same information, but it's important that we understand what blood pressure is and why it's important before we move into what hypertensive emergencies and urgencies are. So the first thing we want to talk about is, what is blood pressure? Technical difficulties here. Hold on. I think we just do this. Okay, sorry about that. So what is blood pressure? Blood pressure is the force of the blood against the walls of the arteries. And obviously the more force you have, the higher the blood pressure is. So we'll talk about, just very quickly, the flow of blood in the heart. So what happens is the blood comes from our body into our heart, the top chamber of our heart. flows down to the bottom chamber of the heart, goes out and gets oxygen from the lungs, and it comes back into the top chamber of our heart and goes down through a valve into the bottom chamber of the heart. And the bottom chamber of the heart is the left ventricle, which is really important because the left ventricle is really what we like to call the powerhouse of the heart, because that is what pumps the blood out to the entire body, the oxygenated blood that goes out through the arteries into the body. So the more force that heart has to use, or the bottom part of the heart has to use to get it out, the higher the blood pressure is going to be. So after a while, if your heart has to use a lot of force over and over again and get that out, then the heart stops working efficiently. And that is what hypertension does. It stops the heart from being efficient. So that's why we want to make sure that we are controlling our blood pressure. So blood pressure is made up of two numbers: the systolic number, which is the top number, and the top number is that it represents when the blood is being forced out of the heart and into the body, and how strong that is. That is the top number, the systolic. The diastolic number, that's the bottom number, and the bottom number is when the heart relaxes and it fills back up with the blood. So those are the two numbers that you need to know for blood pressure: systolic and diastolic. And now a lot of people, when I'm taking blood pressures, like in my office, they will ask, well, how do you know which number is which? How can you tell when you're taking a manual reading? So just to digress a little bit, when you're taking a manual blood pressure, you pump up to about 30 millimeters of mercury above what your normal blood pressure is. So let's say that your normal blood pressure is 120 for the top number. You're gonna pump up to 150. And then you're gonna slowly release that air until you can hear a heartbeat. And when you hear that heartbeat, whatever number corresponds with that heartbeat the first time you hear it, that is your systolic number. And then you continue to release that pressure, that air, until you no longer hear that heartbeat. And when you stop hearing that heartbeat, that is your bottom number. That is the diastolic number. So you ask why, or which number is more important, the systolic or the diastolic number? And the answer to that question is they're both very important numbers, and we don't want either one of them to be elevated or high. But if you're looking at it strictly from a cardiovascular standpoint, then we would say that the systolic, the top number, is the more important number, because if that number is high, that is more of an indication that there could be some cardiovascular disease going on. Okay, let's click on to the next screen. Okay, and so we'll talk about why it's important to control your blood pressure. So high blood pressure can have an effect on the entire body. It impacts the brain, the eyes, the heart, the kidneys. All of these things are affected by uncontrolled hypertension. It can make you have a heart attack. It can cause you to have strokes. It can have heart failure, loss of vision, memory problems. All of these things are affected when we don't control our blood pressure. That would be why we would need to monitor our blood pressure, especially if you have a diagnosis of high blood pressure. You want to make sure that you're monitoring your blood pressure. And the reason you want to do that is because a lot of people, there are people who have symptoms, but a lot of people can walk around with high blood pressure and not have any symptoms at all. And blood pressure can be affected by so many things. And, you know, there are genetics that you can't escape from, genders, health issues, diets, you know, alcohol intake. So many things can affect your blood pressure. So we want to make sure that we are monitoring these things on a regular basis so that our blood pressure does not continue to be elevated, especially if we are not having symptoms and we have high blood pressure. For example, I was diagnosed with high blood pressure when I was probably about 36 or 37. But I had always had elevated blood pressure. And as I said before, I used to work in fitness. So Even as a young 20-something-year-old who was in relatively good shape, as I worked in fitness and didn't have any health issues or anything like that, my blood pressure always sort of ran on the higher end of normal. So my doctor had me monitoring it so that you could know if it went to another stage. However, I didn't have any symptoms. I never had any headaches or, blurry vision or, anything that would indicate that there was something wrong. But I did, in a sense, have elevated blood pressure, and that was because it ran in my family. I have it on my maternal and my paternal side, and African American. Probably ate a little more salt than I should. I like potato chips, so those are the reasons why, at such a young age, I was diagnosed with elevated blood pressure, and we will get into what exactly the stages are of blood pressure very shortly. So those would be some of the reasons why you want to make sure that you are monitoring your blood pressure on a regular basis. Uh-oh. There we go, sorry. So the stages of blood pressure, we have our normal blood pressure, which is less than 120/80. So that is what we call like our textbook blood pressure. That's where we want your blood pressure to be, less than 120/80. Doctors don't tend to get worried if you have a blood pressure over 100/70 or something like that. So I know a lot of people get concerned when their blood pressure, drops, down into the low 100s. But we don't tend to really be that concerned about it unless you're having some kind of symptoms, unless you're feeling lightheaded, unless you're feeling dizzy or something like that, then that might be a little more cause for concern. But less than 120/80 is ideal for your blood pressure. The next stage is elevated blood pressure, which is where I was telling you when I was in my 20s. That's where I was. That's what I was diagnosed with. Not high blood pressure, but just elevated blood pressure. And that's between 120 and 129 for the top number, and then less than 80 for the bottom number. The next stage is hypertension 1, which is 130 to 139 for that systolic number, that top number again, to 80 to 89 for the bottom number, which is that diastolic number when the heart is relaxing. Hypertension 2 is 140/90 and above. And hypertensive crisis is what we're going to talk about today, and that is 180 or above to 120 or above. So that's what we need to be concerned about as far as today is concerned. So what is hypertensive crisis? So as I just said, hypertensive crisis is a severe increase in your blood pressure where your systolic blood pressure is 180 millimeters of mercury or greater, and your diastolic blood pressure is 120 millimeters of mercury or greater. Okay, a blood pressure this high can cause damage to your blood vessels. These vessels, they become inflamed and they start to leak blood throughout the body, and that can cause the heart to stop pumping effectively. So like I was saying earlier when I was telling you the flow of the heart. So when these vessels start working inefficiently, they start causing the leakage of the blood, and then your heart cannot pump effectively. And over time, when that bottom chamber of the heart, that left ventricle, when that starts to have to work harder to pump the blood, then it can grow in size. It becomes rigid and strict and more restrictive, and it can't squeeze and pump as effectively to get that blood out. And so that can put you into what they call heart failure, where fluid starts to build up in the body and can cause a lot of damage to your body and your organs. So over time, that's what happens when your blood pressure is elevated for an extended period of time. So some symptoms of hypertension or hypertensive crisis are headaches, blurred vision, seizures, chest pain, shortness of breath, and swelling. So the number one symptom that most people will complain about would be headaches. Again, not everybody has these symptoms, and that is why it's important to monitor your blood pressure, because blood pressure is often called the silent killer. And the reason it's called the silent killer is because, as I said, many people are walking around with elevated blood pressures and they're not having any of these symptoms. And it might be a point where their blood pressure is so high that they start to have these symptoms of headaches, blurred vision, seizures, chest pain. And if they don't get immediate attention, then it could be a life-threatening situation. So we want to make sure that we are addressing all of these things and monitoring our blood pressure. Okay. There are two parts of hypertension. There is an urgent crisis and there is an emergency crisis. The urgent crisis is when your blood pressure is 180 over 120 above, but the doctor does not think that there is any damage to any of your organs. And then there's the emergent crisis where it's the same situation, but the doctor fears that there may be some damage to your organs. We did find that a research from the University of Tuzla, it showed that most people who have hypertensive crisis do suffer, or regular blood pressure, issues, suffer from headaches, chest pain, and vertigo. And the same study showed that when they're in a hypertensive crisis, the most common symptoms are headaches, chest pains, and shortness of breath. Okay. Number one reason for people to go into a hypertensive crisis is medication non-compliance. That means that they're not taking their blood pressure on a regular basis, or they're not taking their blood pressure at all. We often have, patients who just, they just don't want to take medications. They're just, I don't want anything to do with this. Do I need to take this med? So the doctor will put them on medication because obviously their blood pressure is elevated, and for all of these reasons that we discussed before, we want to make sure that their blood pressure stays controlled so that it doesn't begin to affect their kidneys and their lungs and their heart and all these other things, memory loss, so forth and so on. But they'll come in on their medication and they'll take their medication and say, well, my blood pressure has been running 120 over 76 for the last 3 months. And I don't really think that I need this medication. But you do need the medication because your blood pressure is running at 120 over 76 for the last 3 months because you're on the medication. And so we will be able to see that you need this medication, because if we take you off of the medication, you will see that the blood pressure will slowly start to rise, which brings me back to monitoring the blood pressure. That's a reason why you want to make sure that you're monitoring your blood pressure, because when you monitor your blood pressure, we can say, hey, on this particular medication, I was on amlodipine 10 milligrams and my blood pressure went down to, 98 over 70 and I felt a little lightheaded. If you're monitoring that at home, then you can just call the doctor and say, hey, this is how I've been feeling. This is what my blood pressures have been running. And the doctor can make adjustments to your medications based off of that. Also, if you stop taking your medication and you're monitoring your blood pressure at home, you can say, hey, I stopped taking my medication and this is what's going on. Or you recently changed my medication to this, and now my blood pressure is rising to this. And so we can make sure that we have you on the most effective medication so that we don't get you into the hypertensive crisis. Now, hypertensive crisis, I will say, is rare. Not a lot of people have hypertensive crisis, but it is something that we need to be concerned about. So we need to make sure that you're on the appropriate medications. We need to make sure that your blood pressure is well controlled. So having said that, another thing that I want to talk about as far as what can cause medication or hypertensive crisis is over-the-counter medications. So a lot of times you'll read the boxes of different medications and they say, if you take this, or if you have this issue, or if you have that issue, contact your doctor first. Very important. The number one thing that we see in my office is over-the-counter cough and cold medicine, over-the-counter allergy medicine. So those things can affect your blood pressure in a negative way. They can increase your blood pressure. So if you're already having high blood pressure and you begin to take this over-the-counter medicine that can also raise your blood pressure, we need to be aware of that. So we can make sure that we're monitoring and that your blood pressure is staying controlled. So can you not take any cold medicine? Of course you can take cold medicine. The cold medicine that you should not be taking though is any cold medicine that has the DM in it or the D. So if you have like the Mucinex DM, that's not a good medication for a person with hypertension to take, because that DM, that expertin in it, increases your blood pressure. So regular Mucinex, we will tell you that you can take that, or Robitussin, Guaifenesin, Sudafed, whatever it is, your choice of cough or cold medicine. Those are fine as long as they don't have the DM in it. Same goes with the allergy medications. There's a lot of like the Allegra D. Don't recommend that for a person who has hypertension, only again because it has that D in it, which will cause your blood pressure to go up while taking that medication. So make sure that you're reading your pamphlets on your over-the-counter medications because they can affect your blood pressure, and that is why they have that recommendation on there to contact your doctor prior to taking any of these medications. Let's move on here. Okay, so hypertensive crisis. So how are they diagnosed with hypertensive crisis? Hypertensive crisis is diagnosed by your doctor. They will come in, they will assess you. They'll ask you several questions about your medical history, questions about your compliance with your medication, what symptoms you're having, what medications you're taking, that sort of thing. And based on the answers, they will assess whether or not you're in a hypertensive crisis that's an urgency or if it's an emergency. And so if it is a hypertensive crisis urgency, what we want to do is we want to address those blood pressures with at home oral medications. So there's several types of medications that they will give you. Diuretics, which will help to lower your blood pressure. There's ACE inhibitors that you don't need to know all of those things, but there's several different types and categories of blood pressures that work together to decrease the blood pressure. And a lot of people will ask, well, why do I need 3 different blood pressure medications? And the reason you may need, not saying that you do, but you may need these medications is because, again, even though they all decrease the blood pressure, they all work differently. They all are filtered through different organs in the body. So some might cause more damage to your liver or more damage to your kidneys. So the doctor will order routine blood work to make sure that we are monitoring these things so that your kidneys and your other organs are not affected by us trying to control your blood pressure. So those urgent cases, we're going to just monitor at home. For the emergency cases, that's when the doctor thinks that there may be some damage to some other organs and your blood pressure again is elevated. Let's see where we at, there we go. 120 over 80 or greater. The doctor thinks that there is some type of complications with other organs. It's a life-threatening situation. Again, often rare, but it does happen. Those are the things that we need to get taken care of right away. So what do we do with that situation? How do we treat those people? Those people have to go to the hospital, and they need to go to the hospital ASAP because they will need to have IV medications to help lower your blood pressure and get it down as quickly as possible so that it does not cause damage to any other organs or any more damage to whatever organs it's already caused damage to. And so as far as treating the organs that may have been damaged by the uncontrolled hypertensive emergency, those are all treated accordingly from the doctor. So that's really all the stuff that we have on the hypertensive crisis, hypertensive emergencies. Just to reiterate and go through this again, it's vital to make sure that you are monitoring your blood pressure. Even if you don't have high blood pressure, you don't have to monitor your blood pressure on a regular basis as somebody who has hypertension does. But you want to make sure that you are doing it, maybe, once every 3 months, once a quarter, every 6 months, something like that, just so you can keep an eye on your blood pressure. Because again, blood pressure is often symptomless. So we want to make sure that we are monitoring that. For people who do have high blood pressure and are taking high blood pressure medications, you want to make sure that you are monitoring your blood pressure on a more regular basis. And when I say monitor your blood pressure on a regular basis, it doesn't have to be 8 times a day. We just want you to measure once, no more than twice a day, just so that we can see and make sure that your blood pressure is pretty steady on the medication, so that we can adjust your medications as needed. So if you don't have a home monitoring kit, I would suggest that you go out and you get one. From my office, I know we recommend the Omron, I think it's called, you have one right there, right? And so Jenny will show you that when she comes over to do her demonstration. But that is the monitor that we recommend that you take. It has a high validity, reliability content. It's been tested many, many times. So that is a good machine to get. There are several different machines out there. Some cost more than others, but you want to make sure that you're getting something in your budget. But if you want to go with that brand, they have several different ones within that brand that might fit your budget as well. So again, just to reiterate, highly, highly important for you to monitor your blood pressure on a regular basis. We don't want your heart to be affected by high blood pressure and end up having a diagnosis of congestive heart failure, which is quite scary. So monitoring your blood pressure, make sure you're not in a hypertensive crisis. And if you have any questions, we will be glad to answer those as soon as Jenny is done with her demonstration on how to take a blood pressure. Thank you for joining me, and we'll talk soon.
All right, we're just going to trade places. We're trying to abide by all the social distancing and the face covering guidance. And I apologize for not introducing myself, but my name is Jenny Waldo, and I am the Windsor Public Health Nurse. And as a part of our grant series, we are doing the demonstration of the self-monitoring equipment each time we do a workshop. So here is an Omron device. This device does record 2 different individuals. So individual 1 and 2 can be recorded over time. This is the actual electronic device that does the pumping and then gives us a readout of both the pulse and the blood pressure. And then this is the cuff that plugs in here on the side. And then I know I have felt a little clumsy trying to get this on by myself. It would be nice to have another pair of hands. But the tubing would come out the bottom when you place it on your arm. It should go on to a bare arm and you should be seated. I think in Paula's presentation she did a couple weeks ago, she talked about getting up in the morning, emptying your bladder, and then sitting down in a quiet place, resting your arm on a table or desk. This gets placed on your upper arm, and we want this tubing about an inch above or lined up with the antecubital area, but about an inch above the antecubital area. And then you tighten. I think you gotta be patient with yourself, because I know for the past couple of weeks when I've gone to tighten the cuff, I have pulled it and then the tubing has been unaligned. So this week is a little bit easier. Goes on nice and tight. You rest your arm, and then the rest is pretty simple by just simply pressing the start button. Giving it a minute to inflate. And this should be done quietly, correct? No talking?
No talking.
I broke my own rule.
Sitting up straight, feet flat on the floor, and back rested on the chair if you can.
Okay, so I broke several rules. Back up against the chair, my feet flat on the floor. And then just waiting quietly as the device measures. All right. And that's that. So with that, we will stop the recording and then we will open up the cameras and then have an open up for question and answer. So just give us a minute as we work through the technology.